Hello everyone, my name is Dr. Raveesh Sunkara. I'm a neurosurgeon at Arête Hospitals. Today I'd like to discuss a topic that all of us should know in detail, brain stroke. Brain stroke not only affects the person but also changes the entire family's life. It affects millions of people around the world. So what is brain stroke? Brain stroke is a condition in which the blood supply to the brain is reduced or cut off and the part of the brain that is affected loses its functions. Brain stroke is a critical medical emergency, and as the saying goes, time is brain. That means the more the delay of onset of the treatment, the more brain tissue is destroyed. For this, what can we do? First thing we have to understand is the symptoms of the brain stroke, and a simple abbreviation called FAST helps you remember the main symptoms of brain stroke. Now what is FAST? FAST is nothing but face, F for face, that is weakness of one side of the face, A for arms, that is weakness of one side of the body of arm and leg, and S, that is speech difficulty, and lastly T, that means time is of most essence. To understand the pathology of a brain stroke, you have to understand the different types of brain stroke. A brain stroke occurs when the blood supply to the brain is either stopped by a blockage in the blood vessel or the bursting of the blood vessel causing leakage of that blood vessel into the brain. Now, a blocking of the blood vessel is called ischemic stroke, and a bursting of the blood vessel into the brain is called hemorrhagic stroke. The treatment of both these types of stroke is very different. In case of an ischemic stroke, we tend to provide treatment so that the blood supply to the brain tissue is restored. This is achieved by few treatments like clot busters or mechanical thrombectomy. But you have to understand that this is possible only for a brief period or a golden period of time. Usually, a best result is achieved if the patient is able to reach the hospital and get the treatment within 4 to 5 hours. Sometimes we are able to do mechanical thrombectomies up to 24 hours. Now, a person going to the hospital within 4 hours and receiving both treatment with clot busters and mechanical thrombectomy can achieve a complete resolution of the blood supply to the brain and a complete resolution of the stroke symptoms. A lot of people or patients ask me, why can't we do this beyond 24 hours? Now, doing this after 24 hours becomes detrimental as there is something called reperfusion injury, which is more dangerous than the stroke symptoms. Reperfusion injury is a complex phenomenon which occurs when there is sudden resupply to the brain which was not receiving blood supply for a long time. This causes some aberrant oxygen species to be released and thus increasing inflammation, ultimately causing more damage to the brain tissue. The second type of stroke or a hemorrhagic stroke is the one in which there is a bursting of blood vessel causing bleeding inside the brain. Now, if this bleeding inside the brain is excessive and it causes pressure to the brain, then it is called raised ICP. Now, this not only destroys the brain tissue which is affected by this blood vessel, but also causes a pressure on the regular part of the brain, and it might warrant an immediate decompressive surgery. What we do in this decompressive surgery is that we cut a part of the bone and place it in the abdominal wall or in the bone bank so that we are providing enough place to the brain tissue to swell, thus protecting the regular brain which is not affected by the stroke. On the whole, you have to understand that the goals of the treatment of stroke include trying to restore the blood supply to the affected part of the brain, and secondly, protecting the healthy brain around the stroke tissue, which is called penumbra. Another important thing you have to understand is choosing the right facility for the treatment of stroke. As you know, there are different types of stroke and different types of treatment. A facility that can provide a holistic treatment, that is, having an interventional neuroradiologist and a neurosurgery team, helps us cover all the aspects of stroke treatment, thus requiring the patient not to be shifted during emergency situations. And finally, you have to understand that always prevention is better than cure. Maintaining a healthy lifestyle and having regular exercise, cutting down on your alcohol and smoking can help prevent stroke. Share this information with your friends and family so that we are able to spread the awareness on stroke and we are able to save lots of brain out there.